What are some different ways of healing? So we can think of all of the ways of healing as being encompassed by the anthropological term ethnomedicine, right? So ethno means culture, basically, or people. And so ethnomedicine, generally can be used to talk about any kind of medicine that any culture uses. And we often use it to talk about non-Western or non-biomedical healing. But in fact, biomedicine, which is scientific-based Western medicine, as well as other forms of medicine that are scientifically based, they are also forms of ethnomedicine because they are also culturally bound with cultural expectations. So biomedicine, generally refers to the types of medicine I think that most of us are most used to when we visit our doctors or go to a clinic or a nurse practitioner, a pharmacy, right? Generally, we have a symptom, or more symptoms. We ask a medical practitioner with years of education and a particular degree to either a PhD, either an MD or a DO if it's a doctor of osteopathy, or a nurse practitioner to diagnose something based on our symptoms. We are given some sort of treatment or medical supplementation, depending on what it is, maybe exercise, if it is, you need physical therapy, etc. And then we're sent home, right? They may call us to check up on us. Sometimes they will, sometimes they won't. But we generally don't have much more contact if we end up, getting better from that particular diagnosis. So there's a sort of distance between the patient and the doctor. The doctor is seen as someone who has a lot of prestige, right? Going back to our discussions of power. People are not generally expected to question doctors, not their diagnoses, not their background, not why they are prescribing one drug over another, or whether or not they suggest surgery. And we know from scientific studies of different Western medicine even that some places like the United States tend to do invasive surgeries at a much higher rate than, say, France, who tend to do surgeries at a lower rate. And in general, the results tend to be the same or very similar. So while everyone is working towards the best health of the patient, doctors in different places have different ideas about how to get there. Then non-biomedical healing would be all the other kinds of healing that we might seek out if Western medicine isn't working for us, or the kinds of healing that a person would seek out if they are living in a more traditional community and potentially don't trust Western medicine or don't find that it works as well for them. Or maybe they'll do it in concert with Western medicine. So these would be things like moxibustion, which you see here, or cupping, taking herbs, modifying one's diet in order to fit a particular model, say an Ayurveda model, or a Chinese medicine, TCM, traditional Chinese medicine model. Maybe it has to do with prayer, or certain rituals that are done in order to help someone heal. It may have to do with going to see a practitioner, like a healer, a shaman, a sorcerer, anyone who plays that role in a particular community. So in terms of healing, there are 4 therapeutic processes that anthropologists have outlined. And there are, many different types of healing measures or treatments that may fall under any of these. But in general, we can sort of see that there are 4 different types of therapies that are applied in different cultures. The first one is a clinical therapeutic process. And this is, again, going back to biomedicine, a medical diagnosis by a physician, right? So that would be one way of beginning a healing process, identifying an illness and starting to have treatments in order to heal. The second one is a symbolic therapeutic process, and these would be rituals that would guide someone's healing. So it could be something like having a certain type of tea facing a certain direction at sunrise for 7 days, right? Whenever anything is symbolic, it has to have some meaning beyond just the practical use, right? There's also social support therapeutic process, and that's when people rely on a network of family and friends or the community in order to help guide healing. For instance, trance dancing among the Jukwasi, that involves the community coming out for a trance dance and helping the person who has gone into trance, as well as helping the patient who the trance dancer is trying to aid or assist. Then finally, the persuasive process. And the persuasive process is very interesting because this has to do with the power of persuasion, right? And there is healing that can be done through, the mind believing that certain things work. Now, of course, this is not true for all disease or all illness or injuries, right? Things like that. However, in some situations, placebos or what they might call a sugar pill rather than the actual medicine, an actual medicine has been shown to work because the person's body, because the person believes it's working, the person's body responds as if it is working, because our brains have so much control over our hormones, etc. So we can actually feel better if we believe something is working. At the bottom here is a Navajo, or they call themselves the Diné people, a Diné rug. And this depicts a sand painting. And I encourage you to read about sand paintings in the book and how the sand painting is created, how the patient sits on top of a sand painting. It's not actually a rug, it's actually a painting made with sand by a Navajo or Diné chanter or person who sings the healing. And while the patient is sitting on the sand painting, the holy people will come up and inhabit the person's body and try to help heal them so that they become more in harmony with the rest of the universe. All right, so think about what kinds of therapeutic processes might be going on during this kind of healing ceremony, or also what kind of processes do you best respond to when you're sick? Going to see a doctor or chicken soup from your grandmother, right? Depending on what it is, one may have more healing powers than another.